هيقدم من الناس اللي ما قدمت.
آه،
اي زول. اي.
السلام عليكم.
عليكم السلام محاسن، مرحبا.
السلام عليكم.
كيف الأحوال؟ الحمد لله. وعليكم السلام دكتور ياسر، كيف مسيتوا؟
الحمد
أنا
لله بخير
حكون
والله.
معاكم. الشبكة الشبكة ما مستقرة، مهجة هي برا البيت لكن حتدخل معاكم وأنا حكون فيه، بس الشبكة أتمنى إنها تساعدني.
ما مشكله، ولا مهجه ذاتها، مهجه برا البيت ما شرط، ما ياسر قاعد وانا فيه وفتحيه فيه، ما شرط تقول لها. بس اهم شيء عايزين نعرف الناس اللي هيقدموا، لو انتوا حددتوهم، لو ما حددتوهم يخشوا طوالي.
هم ما حددوا عشان كده، وكل ما نرسل يقول يحددوا بيكون يعني ما في هناي. ما عارفة الليلة هسي بايناه وحددوا ولا لا، لكن الليست المهم موجودة.
خلاص، انت ممكن you can nominate someone و they have to start.
تقريبا. السلام عليكم. تقريبا في ناس حددوهم، بس دقيقة راجع الشات بتاعت الواتساب ورجع عليه. تقريبا في
جدا،
طيب
بس
ثلاثة.
خلاص تمام.
يكون ما قدموا قبل كده، بس اهم حاجه.
أم نبدأ ولا شنو يا يوسف؟ عرفتوا مين هيقدم؟
قاعد أفتش الرسائل، هي كان في ناس قالوا حيقدموا، بس ده
هم
أتأكد من
هم ما موجودين. ما هسي احنا معانا هسي احنا 50 بينا كده، هيكون 40 something من الناس الموجودين ديل السامعيننا. لو كان في واحد من الناس اللي هيقدموا تستار طوالي.
أنا
أوكي
من
تمام
الناس
خلاص.
المفروض تقدم.
من الناس
أنا
عارفة
رقم
روحها
3 في الليستة.
منو؟
أنا رقم 3 في الليستة. أنا إسلام بلبة بكي،
خلينا
رقم 3
نبدأ
في
طالما
الليستة.
انت. أهلا بك يا دكتورة إسلام، طالما أنت موجودة معانا خلينا نبدأ بيكي عشان نكتب الزمن. تبدي أنت معانا، لما الباقيين ينضموا لنا هم بعد ذاك يكونوا وراكي.
طيب،
إن شاء الله.
شكرا، ونبدأ على بركة الله إن شاء الله. شكرا دكتورة محاسن، شكرا ياسر، مرحبا دكتورة فتحية. والترينيز أنا رسلت لكم برضو في الشات بوكس سيرفي، في 4 أسئلة سهلة، 4 أسئلة بس عن التريننج. you just complete the survey and submit يعني.
هذا اليوم.
يا سلام عليك يا ياسر. طيب، أقرأ لنا يا ياسر. هو 4 questions.
Hi, 4 questions. So clinical training questionnaire. How much do you prefer SBE as an online form of clinical training? Not at all, once per month and twice per month. How much do you prefer trainees case presentation as an online form of clinical training? Not at all, once per month, twice per month. How much do you prefer the trainer's case presentation as an online form of clinical training? Not at all, once per month, twice per month. And how much do you prefer case scenarios as online form of clinical training? Not at all, once per month, twice per month. عبارة عن ثانيتين بيخلص.
exactly in 2 minutes. وده بيعكس لنا برضو الفيدباك بتاع الترينيز، لأنه زي ما بيقولوا انتوا أصحاب المصلحة الحقيقية. نحن في نهاية الأمر we analyze the results دي statistical data اللي بيجينا. ما حنلغي أي واحد منهم، لكن ممكن نخفف من واحد ونزيد واحد حسب الفيدباك. فبليز you don't need to write your name. ما في name، ما في أي حاجة. just answer and submit. شكرا لكم. the microphone is yours ياسر ومحاسن. thank you.
الريزلتس بتاعت السيرفي دي ما فيها اسم زول، ما بتجي باسم اي زول، بتجي بس
خالص.
بالهناي cumulative results.
exactly. وبعدين الكوميوليتيف ريزلتس الاسبوع الجاي بنوريها ليهم ان شاء الله. بنوريهم انه كذا برسنتج قالوا كده، وكذا برسنت قالوا كده، وكذا برسنت قالوا كده. و we can discuss it anyway. thank you.
طيب المعانا منو الليله هيقدم اول؟
أنا إسلام بلبة بكر.
تمام يا اسلام، انا هبتدي اقرا في الكيس سيناريو، هقول كلمه قبل الكيس ذاتها وبعدين نتوكل ان شاء الله. قال لي الكيس بتاعت جيتا كان ولا خان is a 32-year-old lady here today for a psychiatric assessment. Earlier, she was pulled over by police for driving at a speed over 100 mile per hour on a country road. Following her arrest, officer noted that she seemed highly agitated and irritable. Preliminary medical assessment and laboratory test revealed no abnormalities. She has been administered oral lorazepam to elevate her irritability and appears more amenable to speaking with a mental health professional now. The task: conduct a mental state examination and risk assessment specifically aimed at identifying indicators of elevated mood state potentially coupled with psychotic features. من الآخر, this is just غالبا is a routine psychiatric assessment with somebody presenting with potential manic symptoms. A pre-reading psychiatric assessment of elevated mood state with potential psychotic features. Elevated mood states, often seen in conditions such as bipolar disorder, can manifest as periods of intense euphoria, irritability, or agitation. When coupled with psychotic features, the patients may experience delusions, hallucinations, or disorganized thinking. The ICD-11 classifies such conditions under mood, between brackets affective disorders, with specific cause depending on the presence and typical type of psychotic symptoms. ICD-11 consideration: look for symptoms that match criteria for mood episodes with psychotic features, including manic episodes with or without psychotic symptoms. For example, 6A60 لما في الآخر الكود for manic episode without psychotic symptoms ولا manic episode with psychotic symptoms. Consider differential diagnosis such as schizophrenia, where psychotic symptoms are predominant and mood symptoms are secondary. NICE guidelines: the National Institute for Health and Care Excellence recommends a comprehensive assessment that includes a detailed history of mood symptoms, psychotic symptoms, and risk factors. For management, NICE suggests considering antipsychotic medication for psychotic symptoms and mood stabilizers for mood regulation. Communication skills for psychiatric assessment اللي هو الكلام الأساسي. When conducting a mental state examination and risk assessment, effective communication is key. Establish a rapport, ensure the patient feels heard, and maintain a non-judgmental stance. Use open-ended questions to encourage detailed responses, and close questions for specific information. Tips for effective communication: start with open-ended questions to explore the patient's experience. Use reflexive listening to validate the patient feeling. Be mindful of your body language to ensure it is open and inviting. Avoid medical jargon when explaining conditions or treatment. دي في أي كيس. الكلام ده كله نفس الكلام اللي بنقوله في أي كيس. Questions to guide the mental state examination and risk assessment. Mood and affect. Can you describe how you have been feeling in terms of your mood lately? Have there been moments when you felt on the top of the world or unusually irritable? Thought process and content. Have you had any thoughts that others might find unusual or hard to believe? Do you ever hear or see things that others can't? Perception. Have you experienced any changes in the way you perceive things around you? Cognition. Have you noticed any difficulties with your memory or concentration? Insight and judgment. What do you believe is happening to you? How do you feel about needing help for these experiences? Risk assessment. Have you had any thoughts of harming yourself or others? Do you have any plans to involve taking risk that might be dangerous to you or others? This assessment aims to identify the presence of elevated mood state, potentially coupled with psychotic features, evaluate the risk to patients and others, and guide appropriate management plan. Remember, the goal is to ensure the safety and well-being of the patient while providing empathetic and evidence-based care. طيب اسلام، زي ما قلنا المره اللي فاتت في اي انكاونتر، انا ما عارف الكيس، ما فتحتها قبل كده، لكن I'm expecting it's going to be a long case, at least 15 to 20 minutes. أي case scenario احنا نتعامل بيها. أول شيء, hi, my name is Dr. Islam. I'm the psychiatrist here today. I'm here to see how can I help you. So what brings you here today? This is the introduction, open-ended question. So can you tell me more about what's been happening? Open-ended questions. بعد شوي more specific. الليلة مثلا قال لك I'm irritable, I'm not doing well. I'm sorry to hear about this. I'm hoping that we can help you here. Move on بعدها اللي هي you validate their feeling وهنا you show empathy and you move on. ما طوالي مع أي سؤال لكن مرة بتعمل الحاجة زي دي. تبتدي ب open ended question وبعد شوي تخش في more very focused questions. نبتدي؟
معلش بقطع يعني مطلوب مني المنتال ستيت اكزامينيشن.
هو في الاخر mental state examination حتعمليه كيف؟ ما هو في الاخر it's an interview. You're going to collect the information على الاسسمنت بتاعت البرزنتيشن. في الاخر المود يعني mental state examination, المود, الثينكينج, psychotic experiences, الكوجنيشن, الانسايت, الجادجمنت, الريسك assessment ذاته. لكن it's more likely and I think it's going to be like 15 or 20 minutes. ما عندي فكرة, هنشوفها هسه. معانا جاهزة؟
ان شاء الله.
نعم.
ايوه ان شاء الله.
يلا نتوكل احنا.
Hi, no idea why I'm here. I really should get going. I have so much to do. Will this take long?
No, I don't think it will take long. I have to present myself to you first. I'm Dr. Islam, a psychiatric registrar. How can I help you today?
You don't need to help me, actually. I know what's happening and I have things under control. The Iman has entrusted me with responsibilities, so I shouldn't even be here. Can we just move this along?
What have you been feeling today?
Honestly, I feel fantastic. Energized, clear-headed, like I'm finally stepping into my real purpose. It's all very positive, you know. I barely slept, but I don't even feel tired. I just have this incredible sense of drive. Everything feels possible right now.
Okay.
Are you still there?
Yes, I'm still there.
All right, just making sure. I'd really prefer to get back to what I was doing. I have important errands. People are actually waiting for me. Can we keep this short?
I want to elaborate more. And how do you feel? How's your mood today?
Honestly, I feel amazing. Really, I can't remember the last time I felt this alive. It's like everything is crystal clear and my mind is working so fast. I'm ready to take on anything, truly. There's nothing to worry about with me.
Okay. Geeta, do you see something people do not see? People around you cannot see?
You know, I just have a different perspective. Not everyone gets it, and that's fine. I notice things, connect dots, feel things others don't. It's part of why the Iman trusts me. I don't expect everyone to understand. It's just the way it is for me.
I want to elaborate more. Do you see something that people do not see?
Look, I know what you're getting at, but it's not about seeing things that aren't there. It's about understanding more, being chosen for a higher purpose. My insight is special, that's all. I don't expect you to fully get it, but it's very real for me.
Okay. Do you hear something that people do not hear?
No, it's not like that. I don't hear strange things or voices. It's more like I just know things or feel guided. The Iman talks to me, but that's different. It's just a deep understanding, you see, nothing weird or anything.
Okay.
All right, so can we be done soon? I really have a lot waiting for me outside. There are people who need me. You wouldn't believe how much I can help.
Okay. Do you know what date today?
Of course I do. It's Tuesday, isn't it? I haven't lost track of time if that's what you're worried about. Everything in my mind is sharp right now. I keep up with everything, don't worry.
Where are you today?
I'm at this hospital, obviously, but honestly, I shouldn't be here. I have no reason to stay. There's nothing wrong with me. I need to get back to my community. There are things only I can handle right now.
Who brought you to hospital?
The police, but that was a mistake. They didn't understand my situation or my privileges. I was just driving with purpose, not recklessly. They overreacted. I should never have been brought here in the first place. What do you mean, is that me? Of course it's me. I know exactly who I am and what I'm doing. I'm perfectly aware, probably more than most people right now. Let's not waste time with these questions.
Okay, Gita. I will ask you some questions. You have to answer it so quickly, I think. Okay. Repeat after me.
All right, that's
1568.
1.68. There, I've repeated it. Can we please move on? This really feels
Can you see it
unnecessary.
backwards? Can you see it backwards?
Sure, 86.1. See, my mind is sharp. There's nothing wrong with me.
Okay. Try to remember this words: star, book, ceiling, towel. Star, book.
All right, but honestly, these
ceiling,
little tests
towel.
aren't the best use of my time. I remember start box, saving, the towel. But truly, I could be doing so much more important things right now.
Okay. Can you just keep this word in mind? I will ask you about it later. Can you count the? Can you say the day of the week backwards?
Sure, that's easy. YADSEUT. See, my mind is working perfectly fine. I don't have any problems with memory or attention.
Okay. Do you remember?
Are you still there?
Yes, I am, Gita. Do you remember where school did you went for?
Of course, I remember I went to St. Mary's, then later to university in Delhi. My memory is excellent, honestly. I haven't forgotten any of these things. You really don't need to worry about that with me.
Okay. Who's the president for India? Of India.
You mean the president? It's Drupadi Murmu, of course. See, I keep up with everything important. My mind is absolutely clear, no confusion at all.
Okay. I will
right.
put you in a situation, and you should think what you will do about it. If you found a little child in the street crying, what will you do for him?
If I found a child crying in the street, of course I would help. I'd comfort them, find out what's wrong, and make sure they're safe. That's just who I am. I always look out for people, especially those in need. It's part of my purpose.
Okay.
Is there anything else? Because honestly, I have so many things waiting for me outside. I really don't see the point in keeping me here much longer.
Gesa, do you feel that you have some skills that other people do not have?
Absolutely. I know I have abilities that most people don't. The Iman recognized it in me. I can see solutions, connect with people, make things happen in ways others can't. That's why I've been given this special responsibility. It's not arrogance, it's just the truth.
Okay, Gesa, do you think people around you want to hurt you?
People can't hurt me. The Iman has given me protection and I'm watched over. I don't worry about things like that. Honestly, I'm more focused on helping others than worrying about myself. That's how it's supposed to be. Are you still there?
Yes, I am. Just be patient.
All right, I'll wait, but I really do hope this is over soon. I have important things to get back to, you know.
Where are you studying or working?
I
Geta,
finished
are
my
you
studies
studying?
already. University in Delhi, like I said. I work now and give back to the community. My education was important, but what I do now, helping others, making a difference, that's what truly matters to me.
Do you think you have a problem, Geta, now with your thinking and your situation?
No, I don't think I have any problem at all. My mind has never been clearer. I'm just operating on a different level right now. And that's because of my purpose. Others might not understand, but I know exactly what I'm doing. There's nothing wrong with me.
Okay. What can I help you with, Geta?
Honestly, the best way you can help is to let me leave. I have responsibilities and people relying on me. That's all I need just to get back to my life and continue my work.
Okay, Geta, do you think maybe you will hurt yourself?
No, absolutely not. I have no intention of hurting myself. I have too much to do, too many people to help. My path is clear, and I feel completely safe and protected. That's not something you need to worry about with me.
Okay. Do you feel that you can hurt anybody else around you, maybe?
No, I would never hurt anyone. That's not who I am. My whole purpose is to help people, not harm them. I care deeply about others, and I only want to make a positive difference. Hurting someone is completely against everything I stand for.
Okay, Geta. Sometimes do you feel that you are sad, crying all the time?
No, not at all. I haven't felt sad or cried in ages. Actually, I feel the opposite, full of joy and energy. There's just so much purpose in my life right now. I don't even have time for sadness.
Are you asking about these feelings and thoughts?
If you're asking about my feelings, they're all positive. I feel inspired, driven, and completely confident in what I'm doing. My thoughts are clear, focused, and full of ideas. There's nothing troubling me right now, just excitement for what's ahead.
Do you have anyone from your family? Can we call or to talk about what you're having more? You
I don't
say
think that's
that you have
necessary.
been.
Honestly, people might not understand what's really happening with me. My family and friends are a bit confused lately. I'd rather handle things myself for now. I know what's best for me, and I don't want to bother anyone.
How's the relationship between you and your family and friends?
It's a bit strained at the moment, to be honest. They're worried because they don't fully understand my situation or the special responsibilities I've been given. I know they're just concerned, but I wish they'd trust me more. Things will work out once they see what I'm achieving.
Okay, Jessica. Do you take any drugs like weed or marijuana or something like that? Illicit drugs?
No, no, I don't use
Have
any
you been
drugs. Never have.
prescribed
I
any?
don't need anything like that. My energy and clarity come from within and from my purpose. There's no need for substances. I want to keep my mind sharp and focused always.
Have you been admitted to the hospital before?
No, I've never been admitted to a hospital before. This is all new to me, and honestly, I don't see why it's necessary now. I've always been healthy, both physically and mentally. There's no history of anything like this in my life.
So this is the first time you feel like this.
Yes, this is the first time it's been like this, so intense and clear, but it doesn't feel wrong. It feels right. I feel like I finally stepped into the role I was meant for. It's not a problem for me, just a new beginning.
Okay, Greta.
All right, if that's
You told
everything,
me
I'd
that the
really
police.
appreciate being able to leave now. I have a lot waiting for me outside. Thank you.
I guess I have just some questions. Be patient. You said that you have been brought to hospital by police. Is that right?
Yes, that's right. The police brought me here, but it was all a misunderstanding. They didn't understand my purpose or the privileges I've been given. I wasn't doing anything wrong, just moving with intention. Honestly, this whole thing has been blown out of proportion.
What have you been doing when the police arrest you?
I was driving quickly, yes, but only because I had important things to do. Urgent, really. I wasn't being reckless for no reason. There are tasks only I can accomplish, and time was of the essence. The police just didn't understand that.
Did you hurt someone while driving so fast?
No, I didn't hurt anyone. I was completely in control. I know what I'm doing. The police overreacted because they don't understand my situation or abilities. No one was in danger. I was just focused on my mission.
Okay.
All right. If you have more questions, just ask. Otherwise, I'd really like to get going soon.
Okay, as I said, be patient. Okay, Geta. Do you think that God gave you special messages or
Yeah.
like a higher purpose than other people?
Yes, absolutely. I know I've been chosen for something greater. The Iman recognized it and I feel it deeply. I get insights, a sense of direction that others just don't have. It's a privilege, really, and I take it seriously. That's why I can't waste time here.
Okay, Geta. I'm trying to elaborate much as I can from you so I can help you. I can help you more to get a better result.
I get that you want to help, but honestly, I don't need help. I just need people to understand my purpose and let me do what I was meant to do. That's all I ask. I appreciate your effort, but I'm really fine.
Are you working, Geta?
Yes, I work. I'm very active in my field and in the community. My role is important and people rely on me. That's why I need to get back as soon as possible. There's so much I can do to help others right now.
Do you have any relationship with other sex, like a boyfriend or something?
Not at the moment. Honestly, I'm too focused on my responsibilities and my purpose to think about relationships right now. My energy is going into my work and helping people. That's what's most important to me right now.
Okay, Geta. If I told you that a child laughed until he died, sorry. A child laughed until he died. What do you think about this?
That's very sad to hear. No child should ever feel that way. If I knew a child was suffering like that, I would do everything I could to help and support them. It's important to care for those who are vulnerable. That's something I truly believe in.
Okay, Gita.
All right. If you have any more questions, just ask. Otherwise, I'd really like to get back to my responsibilities soon.
You will, Gita. You will. Just, I have some questions that I want to elaborate more so I can help you.
I understand you're trying to help, but really, I don't think I need it. My mind is clear, my goals are strong, and I'm just eager to get back to what matters. Still, if you must ask, go ahead. Let's keep it brief, please.
Okay. If I ask you about your mood,
All
from 1 to 10, 10 is very good and 1 is very bad. How do you scale yourself?
I'd say it's around. I don't really need a strict schedule. I have so much energy and clarity that I just handle things as they come. I know what needs to be done and I get it done. My mind keeps everything organized almost effortlessly. I don't need to write things down or plan too much.
Okay, Gita. How's your sleep these days? Are you sleeping well?
Honestly,
الكيس قفلت هنا.
Okay.
طيب زي الأسبوع اللي فات ما سألنا بنسأل الزول ذاته إسلام أنت تفتكري أنت how do you make it يعني how do you evaluate الانترفيو ذاته؟ What went well, what did not go well?
What wasn't going well is I was jumping from question to question without being organized. What went well, but I can communicate in English. I didn't speak that I can, but maybe to some extent I can. But my question wasn't going in a direct manner, not in a systematic manner.
أنا لغاية ما شفت في مشكلة كبيرة كان في الإنجليش. المشكلة كان زي ما قلتي في الفلو بتاعت الانترفيو. والفلو بتاعت الانترفيو دي ما عايزة لا لانجويج. It can be the same issue لو مثلا كان بالعربي ولا بأي لغة تانية. He was a flow issue.
Okay.
دكتورة محاسن قاعدة؟
طيب.
دكتورة محاسن؟ افتكر مشكلة عندها في الشبكة. دكتور عبد الغني؟
يفتكر محاسن ما قاعد دلوقتي يواصل. طيب يا دكتور إسلام you did well. لكن لما بتقول لك I have missions to do, I have a purpose in my life, I am in a hurry, I want to go to finish. ما سألتيها what mission do you have؟ الميشن شنو؟ ما يعني واحدة عندها grandiosity لأعلى درجة. You did not dig in to see what she believes. هي قالت لك أنا حتى أنت لما سألتيها you have extra power ولا extra حاجة سألتيها أكتر من الناس قالت لك أيوة. بس ما بتواصلي to dig in the question to elaborate more. أكتر من مرة كررت لك أنا مستعجل، أنا ماشي عندي purposes، عندي حاجات بعملها، I'm helping people. لكن ما سألتيها خالص مش كده إنه what do you do to help people, what you are going to do، مش كده؟ ده جزء من الجرانديوسيتي بتاعتها.
أيوة.
لكن generally you took good information from her.
انا اضيف
Yes.
حاجه ثانيه. هو في الاخر مثلا في الفلو، زول لما يبتدي معاك انت سالتيها انت الليله، انت يعني قالت لك انا هي طوالي قامت فيكي طوالي هايجه، انا ما اعرف مشغوله في مشكله في حاجه غلط جات هنا، انا need to go as soon as possible. انت طوالي وافقتها، قلت لها انا حطلعك هنا سريع برضو، لكن في الاول داري اعرف عن نفسي. انا ما بقول داري اعرف عن نفسي، انا بقول يعني بقول انا لكن I just want to tell you هو بس الليله I'm دكتور اسلام، الليله I'm the psychiatrist here and I'm here to help you طوالي. وبعدين open ended questions، يعني قلت لك what brought you in، انت الليله خشيتي في الاول brought you in كده، طيب بتسمعي اصوات، يعني انت you jumped immediately into a very specific question. انا باخذ الناريتيف منها، يعني so what brought you in هنا. انا والله ما اعرف، كان في misunderstanding، البوليس جابني ما بجابني. طيب what happened, what was the misunderstanding، خليها تحكي لك هي from her perspective what happened. الليله she was driving at 100 miles per hour، دي الليله يعني دي الليله dangerous driving. فهمتي؟ فوريني انت الحاصل شنو.
أيوه.
the police said they انت were driving in a very high speed. حقول لك حتشرح لك هي الحصل شنو. طيب انت did you think يعني like driving is like in such a speed would be dangerous. بتأسس الليلة thinking الريسك بتاعها يعني what happened. So انت you're talking about
أيوه.
feeling good, tell me more about this. For how long you been feeling well? Do you always feel well? What happened? Did you use any drugs recently? Like I mean, has that ever happened? Have you had depression before? ما في الآخر psychiatric assessment, open-ended question. ما you don't jump immediately على الهناي على voices ولا مثلا الليلة unusual experiences، دي بتجي في الآخر. لكن انت دايما
أيوه.
تكون عارف الحكايه شنو حصل شنو، يعني what happened what brought you in هنا، وبعدين التفاصيل بعدها بتجي بعدها.
أيوه.
Yes.
لكن زي ما قلتي الناس تمشي سيستماتيك في الاخر الليله you get the story you get the story from الزول، بعد شويه التفاصيل بتاعتك بالتشيك ليست you go check list later. انت when you go check list ما بتتوهي.
أيوه.
Yes. Thank you ياسر. خلاص نفتح المجال للترينيز لو عندهم أي حاجة عشان نمشي للكيس اللي بعدها. You have any comment other than what have been said? Please come forward and say your comment. Yes.
عندي بس كلمة اتكررت أنا ما أعرف هل هي صح ولا غلط، عايز الكومنت بتاعك يا دكتور عبدالغني، اللي هي لما كان بتقول لها بي بيشنت. هل مثلا مع بيشنت أنا شاك إنه عنده جرانديوزيتي أو ميني أو سم سورت أقول له بي بيشنت، ولا اتس بيتر إنه أقول له كلمات ثانية مرادفة لها؟
والله be patient دي يعني صعبة شوية. definitely أنا I don't say to my patient أقول له okay just bear with me I want to ask more questions كده. لكن be patient كأنه أنت بتديه instructions. Yes, good point. Bear with me بس. Yes, any other question?
السلام عليكم ورحمة الله. لاحظت يعني إنه الكيس فيها يعني 5 كرايتيريا من الكرايتيريا حقت البرنامج إبسود، اللي كان عندها جراندوزيتي وديكريز نيد فور سليب والتوكاتيفنس، وكان في فلايت فور ايدياز، وكان في impulsivity أو indiscretion اللي هو الريكلس بيهيفير، إن هي سايقة في هاي سبيد، يعني هاي سبيد، ويعني ما not يعني watching for traffic، يعني رولز وكده يعني. فالريكلس بيهيفير او الامبulsivity او الاندسكريشن مع الجراندوزيتي دول الاثنين. ثاني فلايت فلايتليس 3. 4 اللي هو السليب، غالبا يكون في انتربت سليب. والخامس توكاتيفنس. فلو تلاقي 5 من الكرايتيريا بتكون فل، بيكون كافي ان الزول يستخدم برنامج ابيسود.
برضه قالت إنها
وشكرا،
في
يعطيكم
الهابي،
العافيه.
قالت إنها هابي برضه بيسألوا عن المود.
ايوه
Yes,
صحيح،
thank you.
اللي هو yes.
She described
اللي هو
Mahgoub as the top قالت. أيوه ما هي clear، ما هي criteria كلها واضحة بتاعت المانيا. There was no question about this. The question كان how to interview her, how to go systematic and ask her systematic questions, either history taking or mental state examination. Always when we go systematic, we don't miss things, we don't miss questions, we go just systematic. لكن هي clear mania أصلا، هي براها قالت أنا my mood is on the top of the world. براها أقرت بالقصة دي، وسألتها عن الدراجز، سألتها عن الباست هيستوري، ما سألتها عن previous history of depression. قالت ده الفيرست episode في الهاي مود، ما معروف كان حصل لها depression قبل كده ولا لا. No contact with psychiatric services, no previous contact with psychiatric services. She did well. كويس يا إسلام. thank you. لو ما في حاجة يا دكتور ياسر نمشي للحالة اللي بعدها.
طيب الزول الحاجات دي معانا من الثانية.
منو الأسماء اللي عندكم تاني؟ يا إخوانا ده ما
قدم معاك
امتحان يا إخوانا، ده ما
دكتور
امتحان.
ياسر. أنا الشفيع دكتور ياسر، لأنه هسه الشبكة كويسة معي،
تمام.
هسه سامع كويس، لأنه مرات أنا عندي مشكلة الفترة اللي فاتت كلها في الشبكة. هسه
نستغل
ينتهز
الليلة.
الفرصة دي. أي
تمام.
نعم.
تمام يا شفيق. خلاص عندنا الكيس الجاي دي هي أليكس جونسون. A scenario information: Alex Johnson has come in for a consultation following a GP referral. فهنا setting الجي بي عمل له referral للpsychiatrist. This is outpatient, my emergency. The GP has mentioned elevated mood and increased activity levels over the last couple of days, but hasn't specified any diagnosis. The task: conduct a psychiatric history and a mental state examination, paying attention to identifying any psychopathological signs indicative of hypomania. This is almost similar لل previous case.
Yes, and we don't need to read the debriefing ولا حاجة. البري
نفسه
ريدنج ياسر لأنه نفسه.
نفسه.
فهنا التاسك أهم شيء نركز على التاسك. History taking number 1 then followed by mental state examination. معناها تبتدي بالهيستوري في الأول، تشوف الزمن كم، allocate some time for the history, then you go for the mental state examination. Yes.
انا I'm expecting دي حتكون برضو زي يا 15 يا 20 minutes، فحيكون عندك enough time. بس في الاخر open ended question، في الاخر حبة empathy، وبعدين تبقى specific question. It's a very يعني هنا classic interview. It's history based وحبة mental state examination في النهاية. شفيع جاهز؟ شفيع الشفيع الكلام ده ما مطمن.
الظاهر الشبكة
ألو
طشت منه.
ألو ألو.
معنا؟
أيوة أنا كده أنا سامع.
طيب عين بس عشان نكون واضحين، دارين واحد باك اب. حنحاول في الاول، اذا ما نفع حنقفل وحنشوف لنا زول تاني. كويس؟ اذا الشبكه ضايقتك ولا اي حاجه we'll need to see somebody else بعدها. شفيع انت معاي؟ اخوانا القبول
أنا
معي.
معك كده. أي
اوكي مكسب. حنحاول اذا الموضوع قطع وبقي زول الليله في الكيس ذاته بيقول لك هلو ار يو هير والموضوع طول، حنعيد الكيس تاني وحنشوف لنا زول تاني. كويس؟
لا تمام.
يلا توكل على الله.
ألو ألو.
Wow, what a time to be alive, hey? Don't you agree? Hang on, who are you? Are you still there?
اخوانا داري لنا زول تاني.
ممكن أنا
ألو
أحمد مصطفى أحمد.
ألو
الشفيع معلش حنشوف لنا زول تاني، الشبكه بتاعتك قطعت.
ألو.
الشفيع
يا شفيع انت ما بتقول الو، ما بتقول الو، انت بتخش طوالي في الانترفيو ما الو.
لا هو
سألك
افتكر
قال
هو
لك
ما
ار يو
كان
ذير.
موجود.
انت حسي موجود يا الشفيع ولا ما موجود؟ ده السؤال. انت
أنا
موجود
موجود.
سامعنا؟
أنا سامع الساعة.
طيب خلاص ما تقول للبيشنت الو، انت البيشنت عنده قدامك. خلاص ياسر
لا
جيبوا
ألو
اليوم
دي
من الاول. ولا لينا
ألو.
نحن خلاص سامعينك، نحن سامعينك. لما دام انت موجود خش طوالي على البيشنت.
حندي محاوله تانية اذا الشبكه بتاعتك
طيب
ما كويسه.
لحظة عشان أثبت طيب
اذا الشبكه بتاعتك ما كويسه حنقفلها وحندي زول تاني فرصه.
لما تشوف الفيديو طوالي تبتدي معاه، وأول ما تشوف الفيديو فتح تبتدي معاه طوالي يا الشفيع.
الشفيع قاعد؟ الشفيع يا اخوانا شوف لنا زول تاني، الموضوع ده شبكته الشفيع شبكته ما كويسه الليله.
أحمد مصطفى قال حيقدم، أحمد مصطفى.
طيب احمد معانا؟
ايوه انا معاكم. السلام عليكم، انا معاكم.
وعليكم السلام. يلا حنبتدي.
Wow, what a time to be alive, hey? Don't you agree? Hang on, who are you?
Hi, my name is Ahmed Mustafa. I'm a psychiatrist doctor. I'm here to ask you some questions to help you. What brought you here?
Brilliant. Hi, I'm Edistapa. Honestly, I'm just on a roll lately. Work's been phenomenal. Creativity off the charts. My GP sent me here, but I feel fantastic. I guess people noticed I've been extra enthusiastic, but that's just what happens when you're smashing goals, right?
Okay. Why did the GP brought you here, do you think? Do you think?
Sorry, I'm not sure what you mean there. If you're talking about being sent here, honestly, people just saw I was more energetic than usual. But that's a good thing. I'm just running at full speed, ideas, projects, everything flowing. Isn't that what we all want?
Yes. How was your mood lately?
Motorola? Sorry, you've lost me there. If you mean my phone, it's barely keeping up with me. But if you're talking about something else, you'll have to clarify. My mind's on
I'm
work
asking
and ideas, not gadgets.
I'm asking about your mood. How is it lately?
Chikram mode? Not ringing any bells, sorry. Honestly, if it's about energy or mood, I've been on
How
fire,
do you,
absolutely buzzing more than ever. If you mean something else, you'll have to explain. My head's all about work wins and new projects right now.
you tell me before that your energy is increased on the roof. What was you doing lately?
Oh, absolutely. The energy's unreal. I've been pouring it all into this marketing campaign. Late nights, barely any sleep. But the results are insane. I've redesigned the whole branding strategy, pitched new ideas, everyone's loving it. Feels like I'm unstoppable right now.
Mm. Uh,
Are you still there?
I'm here with you. I'm here with you. So how is the marketing was going? Did you perform better than everyone else?
Oh, hands down. I'm smashing targets left and right. My presentations have everyone excited, clients are thrilled, and new ideas just keep coming. Honestly, I feel like the star of the team right now. It's an amazing feeling. Like everything I touch turns to gold.
Mm. Anything else going good for you?
Yeah, everything feels like it's falling into place. Work's incredible. I'm socializing more, barely need any sleep, and I'm still sharp as ever. Even my friends are noticing how switched on I am. Honestly, it's a real rush. I wish every week was like this.
Can you tell me more about your socializing? Your social...
Sure, I've been out loads. Meeting friends, networking, just chatting away. I feel super confident, like I can talk to anyone about anything. People seem drawn to my energy. Sometimes I notice they look a bit overwhelmed, but honestly, I'm just having fun. Feels great.
Okay. What about your did you make any new friends easily?
Disney? Ha, not quite, but honestly, new plans are popping up all the time. I've got fresh ideas for campaigns, side projects, even thinking about starting something of my own. My mind's always racing. There's just so much I want to do right now.
Do you think your work is above average, or you are special? No one is like you.
Absolutely. I mean, I don't want to brag, but I genuinely feel like I'm operating on another level right now. Ideas, execution, energy. It's all just flowing. Honestly,
So,
I don't think anyone in my team is keeping up with where I'm at. It's a brilliant feeling.
so, so do you think you are? Do you have special abilities?
Honestly, it does feel like it lately. My mind's sharper, ideas come faster, and I can connect dots others miss. It's like I'm firing on all cylinders. Maybe it's just being in the zone, but yeah, right now, I feel pretty unstoppable.
Okay. Um, do you have
Are you still
any
there?
problem? Yes, I'm there. Do you have any problem in work or with the people?
Problems? Not really. If anything, people at work seem impressed, though maybe a bit surprised by my energy. Some colleagues say I'm too much lately, but I think they just can't keep up. I'm just focused on keeping the momentum going and getting results.
Mm. Do you find yourself easily distracted?
Yeah, sometimes. My mind jumps from idea to idea. It's like I've got 100 things going on at once, but I see it as a strength, keeps things interesting, and helps me spot new opportunities others might miss. I just roll with it.
Right. How do you think of yourself? Are you a very important person or the best person?
I mean, I feel pretty important right now. Like, what I'm doing really matters, and people are noticing. I wouldn't say the best, but I'm definitely making a big impact. It's hard not to feel on top when everything's going right.
Do you find yourself seeking more pleasurous activities?
Definitely. I've been going out more, socializing, just enjoying life. Everything feels more exciting. Food, music, conversations. It's like I want to experience as much as possible. Why not? When the energy's there and everything feels this good.
Do you find yourself impulsive or reckless?
Impulsive, maybe a little. When an idea hits, I just go for it. No time to overthink. Reckless? I wouldn't say so. I know what I'm doing. It's just about seizing the moment, making the most of this wave while it lasts.
Uh, for how much these symptoms have been with you?
Honestly, it's just been the past few days, maybe 3 or so. Everything ramped up after that project took off at work. Before that, things were pretty normal. Now it's like I've shifted into overdrive, and I don't want it to stop.
Is this the first time this happened to you?
Yeah, this level of energy and excitement is definitely new for me. I've had good weeks before, but nothing like this. It's like everything switched on suddenly, and now I just can't slow down.
Okay. Do you hear any voices? No one here but you?
No, nothing like that. No voices or anything weird. Just my own thoughts, but they're racing a bit. It's all me, just thinking a lot and fast.
Do you see anything nobody sees but you?
No, I don't see anything unusual, nothing out of the ordinary, just what everyone else sees. I'm sharp, fully aware, just buzzing with energy and ideas, that's all.
Do you think there's people are around to harm you or following you or something like this?
No, nothing like that. I don't think anyone's out to get me or following me. People pay attention because I'm making waves at work, but that's just success, not anything strange or threatening.
Mm. Uh,
Are you still there?
do you smoke or drink alcohol?
I might have a drink socially now and then. Nothing excessive. I don't smoke. Honestly, I don't need any of that. My energy's high enough naturally these days.
Do you use any drugs like marijuana or amphetamines or something like this?
No, I don't use drugs. Never really been interested. I get my buzz from work and life, honestly. No need for anything artificial.
Uh, is your libido high these days?
No, not today or any other recent day. Haven't touched anything like that. Just riding this natural high from all the excitement and success at work. That's more than enough for me.
Yeah. Do
Great.
you
If
think
you've got
God?
more questions, fire away. I'm ready. Always up for a chat,
Okay,
especially when things are going this well.
I'm glad to hear that. Uh, did God gifted you
Thanks.
any special abilities?
Sorry, could you repeat that? Not sure what you mean. I'm all ears. Just let me know what you want to ask.
Did God gifted you any special abilities no one else have?
Honestly, it feels like it sometimes. My mind's firing so fast, ideas just keep coming. I feel sharper and more creative than ever. Maybe it's just a hot streak, but right now I do feel a bit special compared to everyone else.
Okay. How is your concentration?
It's a bit all over the place, honestly. I jump from one idea to the next, but it's working for me. I start something, then another thing pops up and I tackle that too. Feels like multitasking on steroids, but the results speak for themselves.
Do you feel this by yourself or other people told you this about you, that you are doing great?
A bit of both, really. I feel it for sure. Energy, confidence, everything. But people at work and friends have definitely noticed too. They've commented on how driven and upbeat I am lately. I think it's obvious to everyone around me how well I'm doing right now.
Like, how did this affected your life?
Honestly, it's been amazing. I'm getting more done, feeling happier, connecting with people more. It's like everything's in high definition. Sure, I'm busier than ever, but I wouldn't trade this energy for anything. Life's just better when you're this switched on.
Is there any negative area?
Honestly, not that I can see. I suppose some people might say I'm a bit much lately, but that's just because they can't keep up. I'm delivering results, feeling great, and riding this wave. If there are downsides, I haven't noticed any.
Okay. I believe this is your first contact with psychiatric services, right?
Yeah, that's right. First time. My GP sent me, but honestly, I don't feel like I need it. I just feel on top of my game. But I'm here. So ask away if you need more info.
Is there any member of your family has a family history of psychiatric illness?
Could you finish your question? I'm ready to answer whatever you need.
Is any member of your family has a psychiatric illness history?
Sorry, you cut off there. Is there any what? Just let me know, and I'll answer straight away.
I'm asking about your family.
Oh, right, family's good. We're close. They know I'm busy with work, and sometimes they say I'm a bit full on lately, but nothing serious. They haven't seen anything to worry about, really. Just think
Does
I'm
anyone?
enthusiastic about my job.
Sorry. Does any one of them have psychiatric illnesses?
Not that I know of. No one's mentioned anything like that in the family. We're generally a healthy, upbeat bunch. Nothing stands out, at least as far as I'm aware.
Yeah. Do you think is there any psychiatric illness within you?
Sorry, I'm not sure what
Uh,
you mean by Mr. Will Renew. Can you clarify? If you're asking about my
I-
family or myself, as far as I know, nothing new or concerning is going on. Just the usual busyness and excitement from work.
okay, I will rephrase it. Do you think there is any problem within you?
Honestly, no. I feel fantastic. If anything, I wish everyone could feel this switched on. Maybe some people think I'm over the top, but from my perspective, everything's just clicking into place. I don't see a problem at all.
طيب. If I give you medication, will you use it?
Medication? That feels a bit much, to be honest. I don't really see the need. I'm performing better than ever. But if you think it's absolutely necessary, we can talk about it. I just don't want anything slowing me down.
No, I will give you something will help you.
All right. If you really think it'll help, I'll listen. But I don't want to lose this edge or slow down my progress. Just want to keep riding this wave, you know? As long as it doesn't mess with that, we can discuss it.
But don't you think this wave can it be dangerous for you?
Absolutely. This wave has been a game changer for me. It's boosted my confidence, productivity, everything. I feel like I'm finally showing my true potential. Why would I want that to end?
Because it can be dangerous for you and others.
I get that you're trying to help, but honestly, I feel like this is just my moment. Maybe it's different, but it's working for me right now. People might see it as too much, but for me, it's all positive. I really don't see the harm.
Do you think of, did you ever think of harming yourself?
No, never. That's not me at all. I'm feeling good. Better than ever, honestly. No thoughts like that. Not now or before. I'm way too busy enjoying life and all this energy.
Do you think of harming someone else?
Absolutely not. That's not who I am. I'm all about positive energy and building things up, not tearing anyone down. No thoughts like that. Not even close. I'm just focused on my work, my ideas, and making things better.
Have you been taking care of yourself?
Yeah, pretty much. Maybe not sleeping as much, but I'm eating well, seeing friends, staying active. Just running on a lot of energy right now. I feel fantastic, honestly. No worries about my health from where I stand.
Do your mood switch to be irritable sometimes?
Sorry, that doesn't really make sense to me. If you're asking if I ever switch off or slow down, not lately. I'm always on the go. My mind's always racing. But it's working for me, so I don't see a problem.
I'm asking if your mood can be irritable sometimes. Or can you be irritable sometimes?
Yeah, maybe a bit. If people slow me down or don't keep up, I can get impatient. It's just because I've got so much to do and say. I don't mean to be snappy. I'm just in a rush to get things done.
Do you spend spend a lot of money lately?
I have been a bit more generous lately, treating friends, buying things to celebrate the wins. Nothing crazy, but definitely spending more than usual. Feels good to enjoy the success, you know? I don't see it as a problem right now.
Okay. Do you have any questions for me about what's happening to you?
Honestly, not really. I feel great, so it's hard to see why everyone's worried. But if you think there's something I should know, go ahead and tell me. I'm curious, but I just don't feel like there's a problem right now.
I think you need some medications, so I'll give it to you. What do you think about taking it?
If you really
You
think it's
are in.
necessary, I'll consider it. But I just don't want anything to dull this drive or make me slow down. That's my only concern. I'm happy to listen, but I hope it won't take away this energy and creativity.
So, can you agree you cannot stop medication until you came for follow-up with me?
Right, I get where you're coming from. If it's what you recommend, I'll try it, but only if we can keep checking in. I just don't want to lose this spark. As long as we keep talking about how I'm doing, I'm willing to give it a go.
Thank you.
No problem. Glad to chat. Let me know if you need anything else.
طيب يا أحمد، قبل ما ندي الميكروفون للناس، شنو أنت تعليقك على الهنا interview? How do you think it went? What went well? What did not go well?
I think what went well, the communication with the patient was good. I think so. Was what not good. I was not organized. I think so.
دكتور عبدالغني معنا؟
Yes, yes. شكرا أحمد. It is okay. It's good. Like in some hints of the patient, you should always follow the hints of the patient. Did he mention steroids, or I was just not listening well? Did he mention the word steroids?
I'm not sure, but I don't think so. But if anyone else, إذا واحد قاعد يسمع يتكلم، لكن أنا ما أظن سمعت.
ياسر
He did.
سمعت
He did. He got. I think I feel like high as if I'm on steroids.
as if I am
It's a
on
phrase.
steroids.
أي.
معناها he knows steroids. ففي حالة زي دي أنا برضو بسأله مش كده؟
لا، هو ما
يعني ده
قال انه he's using steroids. He's trying to give an analogy for how high he was.
absolutely. لكن كونه عارف إنه الستيرويدز make him high. يعني is this a usual information for lay people يعني؟ ولكن عرفها كيف يعني الستيرويد makes people high؟ ده سؤالي أنا. بس حكاية الستيرويد.
أعتقد إنه هي phrase عندهم.
Yes, أنا عارف إنها afraid like steroids. معناها he knows إنه الستيرويدز make people high.
لكن صح.
دائما بنسأل patient زي ديل. هو كان so cooperative البيشنت وعنده insight، برضه عنده degree of insight to some extent. he can مع إنه هو شاعر بالشعور ده جميل وما عايز ينزل الشعور، لكن he is accepting your offer of medications. لكن very important إنه نسأل برضه سألته عن الدراجز، لكن نسأل عن any medical conditions برضه مش كده؟ any other medical problems physical problems في الحالات الزي دي.
إن شاء الله.
يعني البيشنت he's socializing قال لك عنده very good networking وهي's smashing his targets. قال يعني فات الحدود كلها. I don't need to sleep مش كده؟ overconfident feeling so great fresh ideas mind is always racing. ده كل السيمتوماتولوجي يعني مش كده؟ jumping from one idea to another. My mind is sharper than ever sharper and faster than ever. هو بيعتقد انه حتى الناس انه sometimes يعني they comment about his high energy. His mind is jumping from one idea to another feeling pretty important. يعني في grandiosity. يعني برضه كان ممكن we elaborate more on the how important, what makes you more important than other people. It is good. It's good. Okay.
شكرا.
Okay, أي comments؟
انا افتكر ان هو كان عنده فلو كويس بتاع questions، يعني اللي هي مثلا كان عندك you went more systematized في الانترفيو، انت you followed on في الميجر symptoms بتاعت المانيك symptoms، لكن بس ال following up on cues زي ما قال دكتور عبد الغني، هو اللي لو قال لك حاجه كده انت ما تمشي يعني شويه just follow up على الكويستشن what do you mean by this can you tell me more follow up على حاجه زي كده، ده اسال الحاصل شنو. تاني حاجة انت لما قلت له medications why because it's dangerous what is the dangerousness هنا؟
معلش.
انت قلت له you need to take the medication because this is dangerous.
انا كان قصدي انه المانيك ابيسود لانه هو كان بيدعي انه الويف از جود، مبسوط بالانرجي، مبسوط بالبرودكتيفيتي حقته، فانا قصدي دينجرس المانيك ابيسود ما
هو
الميديكيشن.
هو ما عارف كده، انت you have to explain that to him. هو بالنسبة له he's accomplishing, he's hitting the records, he's يعني performing best than other people in his mind. يعني انت بتتكلم في حاجة وفي حاجة تانية. He's outperforming everybody and he's outperforming his expectations حتى. فانت ممكن قبل ما تقول له why do you need to take this medicine and I'm afraid انت you have this sounds like more like a hypomanic episode and this seems more like bipolar disorder. And bipolar disorder can be very unstable and it can go into a very psychotic, يعني a psychotic experience where you can have a very depressive episode and things can be very unpredictable. You need to take the medication because this might يعني create a problem for you later on.
تمام.
Yes, this is very important. Is it manic episode or hypomanic episode يا أحمد؟
I think انها hypomanic.
Why؟
اول حاجه الديوريشن 3
Yes.
days.
What did he say about the duration؟
قال انه تقريبا 3 ايام 3 days. تاني حاجة إنه في انكريز في الحاجات لكن ما
Yes,
وصل
قال
3
3
شهور.
days. Yes. قال لك duration 3 days مش كده؟
أي.
Yes.
تاني حاجة السيمتومز يعني are increased لكن ما 3 شهور حق المين، يعني he's productive he's social he's يعني حتى ما ذكر negative impact of this symptom.
Yeah. Okay, good. ما في psychotic symptoms برضه مش كده؟ He
ما
denied
في
all
شك.
psychotic questions you ask him. Okay. Any
برضه هو
comments؟
did not ايوه ايوه لو سمحت لي يا بص، برضه he did not يعني lost from function، يعني still functional يعني socially and at work، لكن برضه طبعا اللي هي unfinished task او unfinished projects دي طبعا characteristics of bipolar. البيشن بيبدأ مشروع وما بيتمه، بنتقل اللي بعده طوال.
Thank you. Thank you.
وحبيت برضه أصلا حاجة ثانية، ما عارف أنا إذا ما تابعتك أو كده، يعني كان مهم إنك تسأل، يعني كان في periods when you feel low or feel depressed. إذا ما سألت السؤال فهو مهم لأنه البايبولار 2 بيكون فيه depression. بس شكرا.
Thank you. والله يا ياسر لو شفت برضه لأنه الكيس الأولانية ما شفنا فيها الفيدباك، إيه رأيك بسرعة كده نشوف الفيدباك؟
وين في الشات ولا
أيوه في الشات هنا لا الفيدباك في الكيس ذاته
في الكيس هنا
مش
ده
عنده
كويس
feedback.
دقيقة بس انا افتحها هنا. طيب الاسسمنت قال اوفر اول بوردر لاين باس، انا طبعا حقعد اقرا جزء منها لكن هم عندهم العاده بيعيدوا الكلام. The consultation The consultation demonstrated a reasonable attempt at conducting a psychiatric history and a mental state examination focused on possible hypomania. The doctor elicited key features such as elevated mood, increased energy, decreased need for sleep, grandiosity, distractibility, impulsivity, and increased social and goal-directed activities. There was also some exploration of risk and social context. However, the assessment was hindered by communication difficulties, inconsistent questioning, and notable gaps in medical medication and past psychiatric history. والحاجة دي المفروض ما تمنعنا نواصل في الموضوع ده. Communication difficulties, we're going to learn the process دي as we move on. كل ما to practice and practice and practice. الموضوع ده is going to improve. لو ما if we did not practice ما هيحصل تغيير. فأنا أفتكر ده ما مشكلة أساسا. Risk assessment was adequate for self-harm and harm to others, but risk to from others and neglect were not systematically covered. عايزين يسألوا ليه هل because of your behavior did people يعني harm you were you subject to any harm from other people recently? The mental state examination was sufficiently addressed, although cognitive assessment was superficial. Communication style was supportive, but at times unclear, and the structure of consultation was somewhat disjointed. Overall, while the doctor identified key psychopathological features, there were significant omissions and area for improvement, particularly in history-taking depth, consultation structure, and clarity of questions. الدبث دي هي ذات الفولو اب كويستشنز الليله اداك كيوز قال لك حاجه انت can you tell me more about this what do you mean clarification دي اللي هم بيفتشوا بالدبث هنا. Information gathering, identifying key issues and priorities. The doctor made an appropriate start by asking what brought you here, which allowed the patient to describe the main concern of increased energy and activity. The focus on hypomanic symptoms was clear throughout, with questions like you will tell me before that you will tell me before that your energy is increased on the roof. What was you doing lately? And do you have special ability? However, the consultation could have benefited from a clearer summary and prioritization of issues identified as the questions sometimes become unfocused. يعني مثلا ليه as you move on in the interview انت ممكن تقول له so you've been telling me that for the last 2 to 3 days you've been feeling great, excessively happy and great, that you've been accomplishing a lot of activities, you've been hitting your goals, you've been feeling amazing, you have not been sleeping for 2 or 3 days. Am I correct? Yes. And you also told me like I mean you've been مثلا كده زيادة. Am I correct? Yes. When you move on. Assessing historical context and relevance. The assessment of historical context was limited. The doctor did ask, is it the first time this happened to you? To which the patient confirmed this was a new experience, but there was minimal exploration of past psychiatric or medical history. There was no clear timeline developed for the presenting episode, and important historical aspects such as previous mood episodes, treatment, and general health were not addressed. For improvement, the doctor could have asked, for example, have you ever experienced anything like this before or had any previous mental health difficulties? Elicitation of presenting issues and details. The doctor effectively elicited many relevant symptoms, including mood, energy, sleep, social behavior. دي احنا قلناها already. However, some questions were unclear and poorly phrased, such as how was your Motorola? لو في الآخر هو سمع غلط ما phrased ولا ما في مشكلة في phrasing ولا أي حاجة. Conducting risk and safety assessment. The doctor addressed key risks, asking, do you ever think of harming yourself? Or do you think of harming someone else? لكن هو بيتكلم عن self neglect. احنا قلناها دي already. Evaluating physical health and wider perspective. Physical health was not addressed in this consultation. There was no question about current or past medical conditions, physical symptoms, or medication used. An example of what could have been asked is, do you have any medical problems or take any regular medications? Gathering psychological, social, and environmental information. The doctor gathered some social information. Can you tell me more about your socialization? Asking about your family, learning about the patient work, increased social activities, and family context. However, there was little exploration of early life, education, relationship, living situation, or financial pressure. The doctor could have asked, who do you live with? How have your relationship been affected by your recent changes in mood? Communication, consultation structure, and management. The structure of the consultation was somewhat disorganized, with frequent topic shifts and unclear phrasing. Why did the GP buzz? ما هي بدي شكل افتكر في الاخر هم ما سمعوا كويس. ما في حاجه ثانيه. Consultation style. Doctor maintained generally supportive and encouraging style. I'm here with you. I'm here with you. I'm glad to hear that, which has helped build rapport. However, at times the consultation felt rushed or unfocused, and the patient occasionally seemed confused by the doctor approach. Attitude and behavior. The doctor attitude was empathetic and respectful. أنا همشي تاني بعد ده. Listening skills. The doctor was responsive to the patient's statement and followed up on key points. However, listening could have been improved by clarifying, focusing responses, and summarizing the patient's statement to ensure mutual understanding. And again, اللي في الحاجات دايما في الكيسز بتكون مثلا أكثر من 15 دقيقة، يعني ما الحاجات الفيري هنا short. Questioning styles اللي هي were clear and relevant معظمهم and others were confusing اللي هي لسه ماسك لنا في قصة الموتورولا. Language use. The language used was sometimes unclear, ambiguous, which occasionally hindered patient understanding. I'm asking about أنا أفتكر بس دي هو ما سمع الكلام واضح، لكن ما في حاجة ثانية. لكن overall
Thank
it
you.
was good.
Yeah, it is good. It's good, no doubt. وهي هم زي ما نحن بنلقى difficulty in grasping their accent, they find difficulty in our accent برضه، مش كده؟
أي.
يعني ايوه this is usual، يعني normal، ما فيها مشكلة. طيب أنا شايف لسه في وقت، أنا شايف الشفيع موجود. يلا يا شفيع، أنا أديك فرصة ما دام شبكتك موجودة، شايفك موجود.
الشفيع
respond to
معنا؟
us. أيوه يلا يا شفيع، سمعنا صوتك.
لو معانا بس اعمل ميوت روحك وسمعنا.
تاني اختفت الشبكة، اختفى تاني.
طيب نشوف منو
يعني
معنا.
أضف زول تاني عشان نص ساعة الباقية دي. في زول تاني ما قدم قبل كده، ما قدم قبل كده. anyone من 64 الموجودين؟ أكيد نصهم ما قدموا. who's going to take over؟ ما it's not a problem يا أخواننا، الزول ما يتردد.
السلام عليكم بوس. أنا منتصر،
عليكم
ما قدمت قبل
السلام.
كده.
وعليكم
تفضل يا
السلام. طيب منتصر.
تفضل.
عندنا
تفضل.
Alice Grant. The scenario: Alice Grant is a 28-year-old accountant who has been working from home. She has presented with an increasing fear of open or public space, which has restricted her daily activities. She has been referred to you by her GP for further evaluation and possible psychological treatment. A task: conduct a psychiatric history. It's very likely إنه دي حاجة بتاع 20 minutes.
طيب ممكن بس معلش نقرأ السيناريو مرة ثانية؟ ما
just
فاهم.
history يا ياسر، just
History.
history. ما في mental state examination.
She is an accountant who works from home. دقيقة ما أعرف هنا. Accountant who works from home who has been coming with increased social anxiety. دقيقة وين هي ثانية. Social anxiety and fear of open public space and restricted her daily activities. She was referred to you by her GP for further evaluation and possible psychological treatment. منتصر
yes
معنا؟
history بس يا منتصر.
اوكي
just
طيب.
history، ما في mental state examination.
البري ريدنج اللي هي حيكون فيها نوع من الأسئلة. بالمناسبة يعني حتى انت لو لاحظت انت if you stick to being very checklisty للأسئلة، اديت العيان فرصة يجاوبك، سألته open ended question وبعدين عملت follow up question، انت you're good.
اوكي
لا
فاين.
لكن open ended question تعرف القصة شنو، الإجابة منو، الحاصل شنو، for how long, what's going on، وبعدين you go checklisty with the symptoms بتاعت panic disorder, anxiety disorder, depression، الحاصل دي كلها. طيب panic disorder and agoraphobia are both anxiety disorders that can severely impact an individual's quality of life. While they can occur independently of each other, they are often comorbid conditions. This knowledge base aims to provide an understanding of both, including their diagnostic criteria as per the ICD-11, as well as treatment guidelines based on the NICE recommendations. What is panic disorder? Panic disorder is characterized by recurrent panic attacks that come on suddenly and without any apparent reasons. These attacks involve intense feelings of fear and various physical symptoms like heart palpitation, shortness of breath, and trembling. According to the ICD-11, the diagnostic criteria for panic disorder include recurrent episodes of sudden onset severe anxiety or fear, presence of at least one of the following physical symptoms: palpitations, chest pain, choking or smothering sensation, dizziness or abdominal distress. The attacks are unprovoked and occur unexpectedly. Persistent concern about having another panic attack or consequences of the attack. The NICE guideline recommend cognitive behavioral therapy as the first line treatment for panic disorders. Medications like selective serotonin reuptake inhibitors can be used, particularly if psychological treatment is not available or has not been effective. Approach: be prepared that Alice Grant may be difficult to engage initially due to her feeling of helplessness and her own anxiety about medical consultation. If open-ended questioning is not productive, the candidate should employ close-ended questioning to elicit core symptoms. Look to begin with, hello, I'm Dr. Ali. I'm a psychiatrist with mental health team. I understand you have been experiencing some difficulties with anxiety. Can you tell me more about that? دي هي introduction وبعدين الليلة open-ended question وبعدين بتدي العيان. History of eliciting core and anxiety symptoms, physical and psychological. Use questions to help gather key information. Can you tell me how long this has been troubling you? Do you remember when this first started? Can you tell me more about what you experienced during that first episode? How often do these episodes occur now? Do you recall how long the episode lasted? Are there specific situations in which these symptoms come on? Rule out other anxiety symptomatology and comorbidities. Do you worry a lot about everything in life? Are there other specific things that you are afraid of? Do you have nightmares or flashbacks related to previous traumatic experience? Do you excessively check things or repeatedly wash yourself or items? Physical symptoms. Can you tell me more about physical symptoms you experience during these episodes? Do you feel palpitation, trembling, or difficulty breathing during these episodes? Psychological symptoms. When you experience these bodily symptoms, what thoughts go through your mind? Are you worried about losing control or dying? Impact and coping. How have these symptoms affected your daily life? Do you tend to avoid situations where these symptoms might come on? How are you coping with these symptoms? Have you used alcohol or any substance to cope? Personal and family history. Is this the first time you are consulting a psychiatrist? Does anyone in your family have a history of mental health issues? How was your childhood? Was there any difficulties? Mood and functioning. How has your mood been lately? Are you able to maintain your hobbies or interests? How would you describe your sleep and appetite recently? Medications and other treatment. Have you sought medical help for this before? Do you have any chronic medical conditions? And are you on long-term medications for them? Key points: ensure that you demonstrate empathetic engagement with the patient who will likely be anxious in the scenario. Poor candidates will score badly if they don't identify when to switch from closed-ended questions to open-ended questions when the patient fails to respond to them. Ensure you cover the full range and depth of the assessment and rule out anxiety conditions and mood disorders. Risk assessing. Although this is not the key purpose of the situation, it is important to ask some simple questions about safety net. جاهز؟
بس التاسك required history taking ومعه شنو تاني؟
history taking وبعدين حبة risk assessment لكن history taking.
I have to discuss about CBT.
يعني انت اذا سألتك what treatment في الآخر.
All right, okay. So you don't have to just history taking, mental state and
حتى ما mental state, it's mainly history taking.
Okay, fine.
All right.
Okay.
Okay, اللي هي Alice Grant, a 28-year-old accountant who has been working from home. She has presented with an increasing fear of open or public space, which has restricted her daily activities. She has been referred to you by her GP for further evaluation and possible psychological treatment.
Hi there. Sorry. Who am I talking to? I'm a bit
Hi-
worried about all this.
Oh, that's fine. My name is Dr. Muntasir. I'm the psychiatrist in the clinic today, and your GP has referred you to us so that we can talk to you about some of the difficulties you've been experiencing lately. Would you mind if I ask you a few
Okay.
questions just to make sure everything is okay?
Yeah, I suppose so. I mean, things aren't really okay, if I'm honest. That's why I'm here, I guess. It's just hard to talk about, if that makes sense.
Oh, that's all right. That's fine. Can you tell me what's worrying you the most these days?
I just feel trapped, really. Like I can't leave my flat without this horrible fear coming over me. It's exhausting, constantly worrying something bad will happen if I go out. I know it probably sounds silly, but it's taken over everything.
So I'm sorry that you feel this way, and I'm sure we can talk about something to help you with it. Do you mind if I ask you what do you mean by trapped in your flat?
I mean, I barely go out anymore. Even simple things like taking the rubbish out or going to the shop feel impossible most days. I just stay in because it feels safer, but at the same time, it feels like a prison. I've lost touch with friends, stopped doing things I used to enjoy. It's not really living.
All right. Okay. I see. I understand how you're feeling, and we'll try to do our best to help you get through this tough period. Can I ask when did you first start experiencing this fear or anxiety?
It started about a year ago after this awful panic attack I had in a shopping mall. I thought I was dying. My heart was racing. I couldn't breathe. Everything felt out of control. Since then, the fear just sort of stuck with me. Now, it's not just the mall, it's anywhere outside, really.
Right. Okay. And did you? And was this the first time you ever experienced this fear?
Yeah, that was the first time it happened like that. I'd never
And
had
was
anything so intense before. I'd
and
get
was there any?
nervous sometimes in crowds, but nothing close to a full-blown panic attack. It honestly came out of nowhere.
Okay. And there was no stress, or there was no major stress that you were experiencing at that time.
Not that I can think of, no. I mean,
Okay.
work was busy, but nothing out of the ordinary. No big life changes right then. It just happened,
Right.
completely unexpected. That's part of what makes it so scary, I guess.
Right. And when you say panic, do you mean, well, can you just describe what happens to you when you have a panic, when you get the panic episode?
It's like my heart's pounding out of my chest, and I feel like I can't breathe properly. My hands shake. Sometimes I feel dizzy or like I might faint. I get this horrible sense that I'm losing control or that I might die. It's terrifying, even though I know it probably isn't dangerous.
Okay. And how long would you say would this episode last for?
It usually feels like forever, but I think it's maybe 10 or 15 minutes, sometimes a bit longer. The fear sticks around even after, though. I'm left completely drained for hours afterwards.
Right. And has the panic affected your sleep at night?
Yeah, sometimes. I find it hard to fall asleep because I keep worrying it might happen again, even when I'm in bed. Some nights I wake up anxious for no reason. It's made sleep
Right.
really difficult.
Okay, I see. So, and how has your mood been there over the past, let's say, 6 months?
Yeah, it's definitely been getting worse over the last 6 months. I barely leave the flat now. Used to try a bit more, but now I just avoid anything that might set it off. It's like my world has got smaller and smaller.
All right. And is there anything specific that makes these attacks happen for a reason? Is there a specific
Mostly,
trigger for these attacks?
crowds or open spaces are the worst, really. Just thinking about going somewhere busy or unfamiliar can set me off.
Right.
Sometimes, even if I try to go out for something small, I start feeling panicky. There's not always a clear reason. It just happens, and I can't control it.
I see. I see. And have you been feeling sad or depressed lately?
Yeah, I suppose I have. It's hard
Right.
not to feel low when I'm stuck inside all the time. I miss my old life and seeing people. Some days I just feel hopeless, like things won't get better.
Right. I'm sorry that you feel this way. Um, would you say that you're depressed on most days of the week, or just every day?
Most days, yeah. There might be the odd day where I feel a bit better, but generally it's just this constant heaviness. It's hard to see a way out of it, to be honest.
Yes, I understand how you feel. That must be very tough for you. Um, so you said you were feeling quite helpless about it. Have you ever had any thoughts about life being not worth living for? Have you had any thoughts about similar thoughts of such nature?
I have felt pretty hopeless at times, yeah. There have been moments where I've wondered what the point is, especially when I feel so stuck. But I haven't seriously thought about hurting myself. I just want this feeling to end, not my life.
All right, okay. And you get some. I understand. I'm very sorry that you feel this way. Um, would you say that and have you tried seeking help in the past or for these problems?
Yeah, I spoke to my GP a while back. They suggested therapy, but I couldn't face leaving the house for appointments. I've tried a few things online, breathing exercises and that, but nothing's really helped much so far.
Right, okay. So yeah, breathing sometimes to help some people, but we will obviously try to help you in the best possible way. Um, uh, have you ever had an
I
episode?
appreciate.
Yeah. And have you tried taking any medicines or drinking to help you ease with the episodes or to feel better?
No, I haven't taken any medication for it yet. I don't really drink much either. Wasn't sure if meds would actually help, but I'd be open to trying if you think it could make a difference.
Yeah, sure. We will discuss this as well. And I will talk to you about talk therapy, cognitive behavioral therapy as well. But we'll just make it at the end, if that's okay with you.
All right, that's fine. I just want to
Oh,
feel normal again, you know? If there's
yeah,
something
sure.
that could help, I'm willing to give it a try, even if I'm
Mm.
a bit skeptical.
Yeah, we'll talk about it, and that's very good. Would you mind if I just take you back to the episodes where you say that you were feeling quite stressed, and when you get episodes of panic, do you sometimes get any feelings where if when people are very stressed, they sometimes hear voices, or they hear like as if somebody is talking to them? Have you ever experienced such episodes when you were having panic?
No.
No. Okay. And have you ever sometimes also people when they quite depressed or sad, they sometimes see things that other people don't see? Have you ever had any such experience?
No, I haven't experienced anything like that. I don't see or hear things that aren't there. It's really just the anxiety and panic, nothing
Oh,
else unusual like that.
all right. And have you been diagnosed with any medical condition?
No, nothing major. I'm generally healthy apart from this anxiety. No
And do you take?
long-term illnesses or anything like that.
All right. So you don't take any medication, for any regular medication prescribed?
No, I don't take any regular medication. Just the
Right.
odd paracetamol for a headache, but nothing prescribed for anything ongoing.
Right. And do you have any allergies?
No allergies that I know of. Never
Good.
had any issues with that sort of
Right.
thing.
Okay. And how would you say your upbringing has been? I mean, your schooling and your how would you describe your childhood?
I work as an accountant. Used to go into the office, but now I work from home full time because of all this. I managed to keep up with the workload, but it's hard not seeing colleagues. I just sort of keep my head down and get things done.
Yeah, it must be difficult for you. And is there do you get any support from family or friends?
Not really, if I'm honest. I don't see my family much, and most of my friends have drifted away since I stopped going out. I talk to a
Oh,
few people online, but it's not the same as having someone actually there. I feel quite alone most of the time.
oh, I see. This must be quite distressing for you. Um, okay. And when you're having a difficult time, what would your reaction be?
I usually just try to distract myself, watch something, scroll on my phone, anything to take my mind off it. Sometimes I
Right.
do breathing exercises, but mostly I just wait for it to pass. I avoid anything that might make it worse. It's not
So you're saying
much, but it's all I can do right now.
good. Okay. So you're saying that breathing sometimes helps ease with the anxiety that you're experiencing. Is that right?
A little bit, yeah. It doesn't
Right.
stop it completely, but focusing on my breathing can make things feel a bit less overwhelming. It's just
Right.
not a real solution, more like something that helps me get through the worst of it.
Yeah, we will try to talk about treatment, and hopefully things should get better.
I really hope so. I just want to feel like myself again. Thanks for listening.
Oh yes, that's my job actually. We're here to try to help you in the best way we can. So treatment-wise, I mean, I think what you are experiencing is what we call a panic disorder with agoraphobia, which is a condition that makes people feel very anxious and have sudden bouts of anxiety. Yeah. All right. And a treatment, we have several options of treatment. We have what we call talk therapy, which is called cognitive behavioral therapy, where you see a psychiatrist or a psychologist, and you have sessions with them, and then we discuss how you manage when you get the episodes and how you can get through this. Would you be interested in such going to such sessions?
I want to believe therapy could work, but I'm nervous about actually going to sessions. The thought of leaving the house is still really frightening. If it could be done online, maybe I'd feel a bit safer trying it. I just don't want to feel like this forever.
I think there are online CBT sessions which can be accommodated, but we'll try to work it. We'll try to find you a suitable booking for that. Would that be okay with you?
Yeah, I think I'd be willing to try that.
So,
Online
okay.
feels a lot less overwhelming than having to go somewhere in person. If it could help
Right.
me get some control back, it's worth a shot.
Yes, it should definitely help you. And it has helped many people having the same condition as same difficulties you're experiencing. There's another option which we call pharmacological treatment, which includes giving you some medication, which you can take once a day, and this should help you with and help you with easing you and making your panic symptoms or condition much better. Would you be willing to go for that treatment as well?
I'm open to it, yes. If medication could help take the edge off the panic and anxiety, I'd like to
Great,
give it a try. I just want to feel more normal again. I'm a bit
great.
worried about side effects, though.
Right. So we have a medicine. It's called paroxetine, which is what we call an SSRI. These medicines have been proven to be have been used a lot and have been very effective in treating patients who have experiencing panic disorder. And it's very effective, and you just take it once a day, and it should take around 1 to 2 weeks for the medication to start kicking off for you to start feeling better. And then we're going to do a follow-up um, appointment where we'll evaluate how you're going, and then we'll take it on from there. Well, does this sound good for you?
Yeah, that sounds reasonable. I'm willing to
Okay.
try it if you think it could help. I just want
Yeah,
to feel
sure.
some relief from all this anxiety. I'll give it a go
Yes.
and see how it goes until we check in again.
Yeah, that's great. So you ask about the adverse effects, and I'll just talk to you briefly about them. Some people in the beginning of treatment may experience nausea, or they may have the feeling that they want to have to throw. Uh, but not all people experience these symptoms. Some other people experience some gastric upset, and others do have some bouts wherein they have brief episodes of diarrhea for a few days. You might also experience some blurring of vision in the first few days of treatment, and some people might experience some dryness in the mouth. Okay, so these are just few of the symptoms that you might experience, but as I said, not all people experience them, and you should be fine with this medicine. do you have any questions you would like to ask or would like to?
Thanks for explaining all that. I appreciate you being upfront. I guess my main worry is if the side effects get too much. Can I stop the medication or let someone know? And how long
Well,
should I give it before I know if it's working?
well, usually we take the medicines for after the symptoms improve for at least a period of 3 to 6 months. But this we will evaluate you on regular basis, and we'll have a follow-up appointments in the clinic, and you should be okay with that. Regarding the other question that you asked about, you shouldn't stop the medicine suddenly without informing us, but you should talk to us, and we will guide you how if you're feeling bothered about the side effects.
الكيس قفلتينا هسه.
Okay.
طيب منتصر انت كيف شايفه الكيس عموما يعني اللي هي مثلا اللي هي when did not go well.
All right. Okay. I think it went generally okay, but I was sometimes missing some clues. I'm not sure if I think I missed a few clues, and I wasn't a bit systematic with questioning.
ما عم بتذكر في كيوز ولا مثلا في اللي يعني انت افتكر you covered most of the questions يعني provide بدنا نفتح الحديث الدكتور عبد الغني خلي يعلق.
Okay.
Yes, and I think it went very well. يعني open-ended questions initially, then closed questions. There was clear empathy and understanding of the patient situation, supporting her actually during the interview as well. The panic episode, she said that she's got to one episode while she was shopping. I didn't know whether you asked her whether she had other episodes of panic episodes, and was it just out of the blue without any, because we all know panic episodes just come out of the blue. We need to confirm that. And
Yes.
if there is any phobias or any other phobias or anxiety for other reasons, you ask her about her medical history, medications. I didn't know whether you ask about drugs or alcohol. Yes, I think you asked about that, and she said she drinks little, not always. I don't know whether you asked about the family history. I can't remember anyway, but I think it went very well. Thank you.
Okay.
أنا
Thank you very much.
and I think it went very well. لو في كومنت على حاجة معينة بس اللي هي دي يعني الناس كلها بتعملها اللي هي to give the patient a chance إنه to complete their answer قبل ما تسأل الكويستشن الثاني.
Yes. Yeah, شكرا لك.
This is a very general يعني شايف في الناس معظم الناس عندها الحاجة دي لكن otherwise نفتكر زي ما قال دكتور عبد الغني يعني it went very well من the introduction, open-ended question, empathy, specific question, associated symptoms. It went very systematically in a very good way.
Thank you. شكرا لك فعلا كلامك صح دكتور ياسر. Yeah, I was stepping بدخل أخش في الكلام without giving her a chance to complete what she was trying to say يعني. بالنسبة لهنا I think the symptoms started قالت 1 year ago. She started in a mall out of the blue. We're starting getting worse. Symptoms get worse from usually في malls وفي cafes. That's why. فبالتالي عندها avoidance behavior.
اوكي انا افتكر خلينا نوقف الشير بعد ده.
Yes, thank you. I think
الناس الحضور اذا عندكم comments.
yes, لو في أي comment عشان to conclude, it's already 2 hours since we started.
السلام عليكم ورحمة الله. طيب يا بص، في حال إنه البيشنت عنده بانيك ديس اوردر مش ايجورافوبيا، زي ما قال الدكتور منتصر، الفيرست لاين هو الاس اس ار اي، لكن it takes 2 to 3 weeks to wake يعني. فهل يعني مثلا في البيشنت قد يكون بيشكي من sleeping difficulty، فهل ممكن ندلله بشورت تيرم وبنزودازولين بعدين؟ يعني is this a good practice إن تختار بنزودازولين and SSRI then you stop the lenses and keep SSRI or not? That's my question. I hope it's clear.
We always say each case is taken on its own merits. You cannot generalize management plan to all patients, similar management plans. Each patient is taken on own merits. Benzodiazepines are good medications, but we always remind their addictive properties, especially with such patients. When they feel very relaxed with such medications, they might not stop it. Anyway, this patient, I don't think she complained of sleep difficulties. She was just trapped in her house, and this was her main problem. But benzodiazepines, SRIs, any medications can be prescribed to any patients if needed. Okay?
Okay. شكرا يا مصر.
You're welcome.
يا
طيب
جماعة انا حاخد الهناية اللينك تاني، مش بتاع الهناية كويستنير، لو في ناس ما عملت الكويستنير قبال ما يطلعوا.
exactly ده الكلام أنا كنت عايز أقوله. Thank you ياسر. You got it at the right time. الكويستشنير ده الهدف منه في النهاية إن إحنا ناخد فيدباك. يعني أنا أتوقع هسه أنا برسله بعدين لإيمان في إيمان تاج الدين في الواتساب عشان تنشروا لبقية النواب اللي ما حضروا. أتوقع 70 اللي حضروا اليوم هي أتوقع 70 أو 68 اتليست، لو شلنا روحنا أنا وياسر 68 response. لكن by the end of tomorrow I expect 100 response، 100 response، لأنه عندي 100 تريني. في النهاية الريزلتس بتاعت السيرفي ده for your own benefits and to improve ourselves in our online clinical training program for the next 6 months. Today is the last day of October. We are left with November، ودايما ديسمبر ما بنعمله كله لأنه بيكون it is the examination month. احتمال نعمل الأسبوع الأول بس أو الثاني في ديسمبر، وبقية الشهر بيكون الامتحان، وبإذن الله بعد ذاك بنعمل البروجرام بتاع January June 2026 and again it is going to be clinical training. I have nothing to add. Yassir, if you have anything to add, تفضل. Thank you very much Yassir.
العفو. واخر حاجه بس افتكر لناس مصر، الاسبوع الجاي افتكر الساعه بتقلب عندكم من هناي، تقلب عندكم من يوم الجمعه الجايه، فاي زول يعني يراعي المواعيد حتتغير، حتبقى ب8 بتوقيت السودان، افتكر هي حتكون نفس الشيء 8 بتوقيت القاهره نفسها.
Yes. Thank you and have a good night.
يلا في امان الله، مع السلامه.
Bye.